Minash-Shaytanir-Rajim. Bismillahir-Rahmanir-Rahim. Once again, welcome to my new lecture. In this lecture, we will discuss about the biphasic liquid dosage form. Biphasic liquid dosage form. In previous lecture, we have already discussed about monophasic liquid dosage form. So, today we will discuss about the biphasic liquid dosage form, which is a two-phase system. One is suspension and the second one is emulsion. Suspension, pharmaceutically, it can be defined as a biphasic liquid dosage form of medicament in which finely divided solid particles are dispersed in liquid or semi-solid vehicle. The solid particles act as dispersed phase, whereas the liquid vehicle act as the continuous phase. Suspension are generally taken orally by parenteral route. They are also used for external applications. As we know that many suspensions which are supplied in the form of powders, and then they are converted into suspension by adding the specified particular amount of vehicle before use. This is done to ensure the stability of the suspension. For example, we have ampicillin for oral suspension, barium sulfate suspension and insulin zinc suspension. So, this lecture is related to biphasic dosage forms, in which suspension and emulsions, these are the primary dosage forms. And suspension, the liquid, it is the liquid dosage form in which the medicaments, they are finely divided into the solid particles and then they are dispersed in a liquid or in a solid vehicles. So, actually in suspension, the solid particles, they can act as a dispersed phase. It is two-phase system. One is dispersed phase and the second one is dispersion medium, and it has clearly written that it must be agitated to be reconstituted before use. The solid particle, they are dispersed, whereas the liquid is used as a vehicle, which is the continuous phase. It means the discontinuous phase is solid particles, while the continuous phase is liquid particles or solvent, which is used as a vehicle. Suspension are generally they are taken orally or by parenteral routes. They are also used for external application as well as, and they are also supplied in the dry powders, which they are converted into suspensions by adding a specific amount of the vehicle before use. And this is the reason, in order to ensure the stability of suspension, so it must be shake before use. For example, ampicillin for oral suspension, barium sulfate suspension and insulin zinc suspensions. So, most of the people, they are asking about the difference between syrup and suspensions. So, actually a syrup is a monophasic dosage form, which is one phase system, and suspension is a biphasic dosage form, in which one phase is dispersed in a dispersion medium. The phase which is dispersed, that is solid particles, and when the particle which are dispersed in the medium, that is called liquid or vehicle, or that is called continuous phase. Inshallah, in my next lecture we will talk about the emulsions, which is also a biphasic liquid dosage form. Thank you so much for watching my lectures.